Good morning, and thank you for joining today's webinar on the Prescriber Tool and the Prescriber Tool Alternative Payment Model. My name is Cordell, and I will be hosting today's webinar. Before we dive into our topics for today, I want to briefly touch on who we are here at the Colorado Department of Healthcare Policy and Financing, or HCPF for short. We administer Health First Colorado, Colorado's Medicaid program, as well as the Child Health Plan Plus and other healthcare programs for Coloradans who qualify. Our mission here at HCPF is to improve healthcare equity, access, and outcomes for the people we serve while saving Coloradans money on healthcare and driving value for Colorado. Today, I will touch on two major topics. First, the Prescriber Tool, how to use the tool, and notably the Real-Time Benefits Inquiry module. And second, the Prescriber Tool Alternative Payment Model. I'll give an overview of the program, what to expect from program year 3, and the next steps for the program. The staff members associated with the Prescriber Tool and its alternative payment model are myself as part of the Finance Office and Lauren Hussey as part of the Pharmacy Office. As we go through today's webinar, a few acronyms are going to pop up in our slides. This slide will serve as a reference for those acronyms. If you have questions or feedback, there are several ways to reach out to us. We will have a questionnaire and feedback form posted on both the Prescriber Tool webpage and the Prescriber Tool Alternative Payment Model webpage. Additionally, you can reach out to us at the HCPF Pharmacy APM email address for practice-specific questions. This webinar recording and resources will be posted on both webpages. With that, I'm going to shift gears and talk about the Prescriber Tool. So what is the Prescriber Tool? This tool is a multifunctional platform accessible to prescribers through most electronic health record systems. It provides patient-specific benefit and cost information to prescribers at the point of care, easing administrative burden for prescribers while improving service to patients. There are several modules within the Prescriber Tool. First is the Real-Time e-Prescribing module. This module allows prescriptions to be sent electronically to pharmacies for Health First Colorado patients, increasing convenience and saving time for patients, prescribers, and pharmacies. Second is the Real-Time Benefits Inquiry module. This module gives quick insight into preferred medications from the preferred drug list, empowering prescribers with drug affordability and cost options. Third is the Real-Time Prior Authorization module. This module allows prescribers to electronically submit prior authorizations, reducing workload and avoiding manual entries, forms, faxes, and lists. Lastly is the Opioid Risk module. This module helps prevent the misuse and abuse of opioids and other controlled substances. The Prescriber Tool started in 2021 to support patients and healthcare providers with information at the point of care. The goals of this tool are to help improve patient outcomes and services, reduce administrative burden for prescribers, and to improve prescription drug affordability. Some of the benefits of the Prescriber Tool are empowering prescribers with rapid information to save time and support with prescription decisions, supporting patients with a smoother, more convenient experience at the pharmacy, and it supports saving Coloradans money on healthcare by improving access to affordable prescriptions. So how can a practice use the Prescriber Tool? If your electronic health record system is compatible with the Prescriber Tool, you will not need to download anything additional. How the Prescriber Tool works within each electronic health record system will vary from system to system and even from version to version. Our current real-time benefits inquiry module vendor is SureScripts. If your electronic health record system is connected to SureScripts, you likely will be able to access this module. HCPF can provide limited support to help providers access the Prescriber Tool in their system, if possible. For more information, please visit the Prescriber Tool webpage. I'd like to spend a little bit of time to go more in depth on the real-time benefits inquiry module, as this module is a little bit more complex than the others. This module gives quick insight and transparency into medications from the preferred drug list, empowering prescribers with drug affordability and cost options. There are a couple of notable items for this module. First, commercial insurance will show different copay amounts for medications. Health First Colorado member copay amounts will remain the same regardless of the medication. Second, up to 3 alternative medications will show for Health First Colorado members. These are the most cost-effective preferred medications within a therapeutic drug class. The alternative listed first is the most cost-effective medication of the alternatives. Lastly, occasionally a brand name medication can be more cost-effective than the generic one for Health First Colorado members. This is due to the rebates that Health First Colorado receives. If you have any questions about other modules not featured in this presentation, please feel free to reach out to us. This slide contains a walkthrough of how to utilize the real-time benefits inquiry module. I'd like to remind everyone again that functionality may vary from system to system. Walking through the steps here, first, the prescriber will need to select the medication and the patient's preferred pharmacy. Second, fill out the entire prescription, including the day's supply and refills, if any. Third, the real-time pharmacy benefit will return information for eligible Health First Colorado members. Fourth, review the preferred alternatives and make a prescription choice. And lastly, send the prescription to the patient's preferred pharmacy. Switching gears again, I'm going to talk about the Prescriber Tool Alternative Payment Model. This program launched in 2023 and is going into the 3rd year of the program. This model is an upside risk-only shared savings program. In other words, there is no financial risk for participating practices. The goal of this program is to increase use and awareness of the prescriber tool, specifically the real-time benefits inquiry module. We do limit the provider types eligible to participate in this program. This slide contains a list of provider types that, if the practice has outpatient fee-for-service pharmacy claims in the applicable state fiscal year, they are eligible to participate. For program year 3, the applicable state fiscal year is July 1st, 2024 to June 30th, 2025. It is noteworthy that community mental health centers are no longer eligible to participate. However, those practices that have rolled over to provider type 78 or comprehensive safety net providers will still be eligible. As we just finished wrapping up program year 2, we want to extend a thank you for the providers and practices who participated. We successfully shared 75% of the shared savings pool with 701 practices. Payments went out on June 25th, 2025. I would like to take a moment and recognize the feedback that we received from program year 2. We appreciate all feedback, and we are working to incorporate feedback into the program. A couple of themes we heard in providers' feedback from the past year are that the prescriber tool saves time, the prescriber tool was helpful and useful, it was great to get information on what medications a patient's insurance would cover. Some providers use the prescriber tool all day long as the tool is working. Some providers encourage us to keep things simple. And lastly, some providers noted that the prescriber tool could be more efficient. With that, program year 3 started on October 1st, 2025. Program year 3, similar to previous years, will provide an incentive payment to eligible providers that complete the required activity for the program year. I'll speak more about the required activity in a little bit. Payments are based on a shared savings pool calculated from the impacts of changes in preferred drug list compliance rates. Each year, HCPF is authorized to share a certain percentage of the shared savings pool through incentive payments to providers. For program year 3, we were authorized to share 50% of the savings pool. Additionally, incentive payment amounts are split into 3 tiers, with the top tier getting the highest payment. Tiering is based on preferred drug list compliance. The highest performing 1/3 of providers will receive the maximum incentive payment. The middle performing 1/3 of providers will receive 85% of the maximum incentive payment, and the lowest performing 1/3 of providers will receive 70% of the maximum incentive payment. Our timeline for Program Year 3 is also very similar to Program Year 2. We are conducting stakeholder engagement and providing an opt-out and contact update form in October. Our required activity for Program Year 3 will be a survey, which will open in early 2026 and close in spring of 2026. We will update the Prescriber Tool Alternative Payment Model webpage with information as we settle on dates. Payments to eligible providers who complete the survey will go out in June of 2026. What to expect for Program Year 3 is also very similar to Program Year 2 as well. Again, we will have an opt-out and contact update form posted on the Prescriber Tool Alternative Payment Model webpage in October. A list of eligible practice NPIs will also be posted in October. This is the list of eligible provider types that had outpatient fee-for-service pharmacy claims in the past state fiscal year. We will be working with Myers and Stoffers again for administrative support. Myers will be sending a number of emails to practices from their CO, RX, APM email. Information will include preferred drug list compliance rates, information on the survey, and incentive payment information. Again, the required activity for Program Year 3 will be a survey that will open in early 2026. Eligible practices must complete this survey to receive an incentive payment. Incentive payments, if any, will be distributed in June of 2026. There are a couple of steps practices interested in participating in Program Year 3 can take. First, the opt-out and contact update form is posted on the Prescriber Tool Alternative Payment Model website. This form can be used for either opting out of communications regarding Program Year 3, note that you will not receive an incentive payment if you select this, or updating your practice's contact information with our team. Please note that this will not update your contact information for HCPF or Health First Colorado, just our team. Second, visit the provider portal to update applicable provider enrollments. Practices will be asked to affirm that their enrollments are up to date on the survey. Summarizing Program Year 3, this is an upside risk-only program with no financial risk to providers. Practices that have outpatient fee-for-service pharmacy claims and are of the appropriate provider type that complete the required activity are eligible for an incentive payment. If you have any questions, please feel free to reach out to us. Looking ahead to Program Year 4, we will be implementing a new pharmacy benefit manager that will integrate with more vendors, including Doctors First, CoverMyMeds, and CenterX. Additionally, we are researching new opportunities for this program. We will post new information on the Prescriber Tool Alternative Payment Model webpage as soon as we can. And that concludes our presentation for today. Thank you for tuning in, and please don't hesitate to reach out to us with any questions.